Welcome to dBrief. I, Sunana, am back to take you through the highlights of the webinar Diagnosis Treatment of Asymptomatic Mild Moderate Covid-19 Patients at OPD of General Practitioners. The webinar was recently conducted by DG Shield in association with Bharati Hospital and Research Center, Purandar Medical Association on 1st August 2020. With every passing phase, a new set of updates create a new set of confusion and extreme panic. The constant rise in COVID 19 cases, although it has created a claustrophobic situation in the country, with the frontline warriors' undying support, resulted in almost 66% as a recovery rate. While the update is indeed good news for us, but the challenge isn't over yet. As per the new guidelines laid by the government, asymptomatic patients are advised to be treated at home and remain quarantined. But how do we know if they are asymptomatic? What if the situations get severe? Does that mean the patient is COVID positive? To shed some light on all these confusion and provide in-depth knowledge for the same, DG Shield, in collaboration with Bharati Hospital and Research Center, Purandar Medical Association, dismisses the doubts regarding diagnosis and treatment of asymptomatic, mild, and moderate COVID 19 patients. The eminent speakers made the session extremely lucid, which included a vast spectrum of causes, symptoms, test, and treatment to address the following topics in detail. Causes, symptoms, and tests to be conducted in COVID 19. Diagnosis and treatment of asymptomatic, mild, and moderate COVID 19. The factors to keep in mind in case the conditions get severe or critical. The first eminent speaker kick-started the session, Dr. Amol Henbre, who is currently holding the position as president of Purandar Medical Association, started by clearing the basic knowledge of COVID 19. The causes, symptoms, and tests to be conducted for a better diagnosis. He suggests that the different type of tests that need to be performed to confirm the amplification of the disease. Since diagnosis plays a crucial role in COVID 19, let's check out his guidelines for what he has to say.
Diagnostic tests are RT-PCR, real-time polymerase chain reaction. It can detect 65 out of 100 COVID infections. Positive is always true, no false positive. In 35% cases, it is a falsely negative. Reporting time is 6 hours to 2 days. Whom to test? Symptomatic, close contact, unprotected contact. Other tests are gene expert, more sensitive, slightly less specific, costly. Antibody tests, query. To fight against virus, many times they false negative, false positive, hence all are query. Then rapid antigen test, very specific, less sensitive, 50 to 80%. Then wrong in 50%, that is false negative in 50%. ICMR has given permission to this test.
Dr. Sachin Yadav, who is currently working in Chintamani Hospital, Pippewadi, Pune, started to address the COVID 19 mild and moderate cases by bifurcating it into 3 groups and suggested the required methods to proceed with it. Through a step-by-step manner, Dr. Sachin Yadav provided detailed knowledge about how to treat the cases and the proper techniques that needs to be followed to give relief to the patients. According to a leading newspaper, a recent study suggests that the use of HCQ resulted in 80% dip in infection risk for health risk, to which let's hear from Dr. Sachin Yadav his views.
Even the IMA has given the survey for most of the hospitals, those patients who are taking hydroxychloroquine and asked them to report if they are getting some symptoms or they are getting protected from the hydroxychloroquine. So there was a lot of controversy on the hydroxychloroquine, but at least in India, we are getting good results with the hydroxychloroquine, even for the prophylaxis, even for the treatment.
To watch the entire video, please visit our website www.dgshield.me and click on the dBrief menu.